Hello, my name is Marie Morandi. I'm a certified specialist in oncology and nutrition here at the Lynn Cancer Institute. Today we're going to be talking about nutritional issues during chemotherapy. As an overview, eating well during treatment impacts how you feel, it impacts your energy levels, and it potentially impacts your healing. This includes adequate protein, fruits and vegetables. It's important to eat nutrient-rich foods to help your body heal and repair. You are welcome to work with a dietitian to determine your specific needs. As an overview, eating well impacts our strength, yes. It impacts our energy levels. It means eating variety of colorful fruits and vegetables, whole grains, high-protein foods to help you with healing, and plant oils. Fruits and vegetables provide antioxidants, vitamins, minerals, and plant-based nutrients that strengthen the immune system and remove toxins. Specifically, eating well generally means 6 to 9 servings of fruits and vegetables per day. One serving can be approximately 1 cup of a raw fruit or vegetable, 2 cups of a lettuce leaf, and 1/2 cup of cooked vegetables. It is important to include cruciferous vegetables daily. This is your broccoli, cauliflower, Brussels sprouts, and kale. Other green foods, fruits with bright orange and red colors, along with berries every day. Eat whole grains, beans, and legumes. Choose fish, lean meats, and poultry. In the last slide, we talked about protein being important for healing. Many times during chemotherapy, our bodies need extra protein. So any snack or meal that you can include a lean protein with will benefit your body as far as healing. Using healthy oils like olive oil, olives, flaxseed oil, sesame seed oils, other types of nut oils like peanut butter or almond butters help with the body's healing. They are anti-inflammatory, and they give those extra calories so that we can meet our needs. If you like, you can try eating shiitake or maitake mushrooms. They have been studied extensively with cancer as an antioxidant and also help support the body with minerals and protein. There are many nutritional issues that can come up during chemotherapy. They include nausea, vomiting, diarrhea, constipation, a change in your appetite, sore mouth or difficulty swallowing, changes in your taste, weight loss or weight gain, dehydration, immune suppression, which is also called neutropenia, and cold sensitivity. On our next slides, we will talk about these issues in detail. Tips for meal menu planning: avoid eating your favorite foods if you're feeling sick so that you do not develop a food aversion. Have your friends and family help you with food shopping and preparation. Make soups, casseroles, other foods in advance, and put them in individual containers into the freezer. For days when you're fatigued or tired, this is an easy solution for a meal. Have easy-to-grab snacks available, like hard-boiled eggs, cheese, crackers, granola bars, peanut butter and crackers, fruit cups or fruit bowls, yogurt, and nuts. When it comes to nausea and vomiting, this is a very common side effect to chemotherapy. It is recommended to eat 5 to 6 small or infrequent meals. Why do we recommend this? Generally speaking, eating more often, put something in your stomach, helps to absorb stomach acids and keeps the stomach more settled. Avoid strong odors with food and other things in your environment like lotions, perfumes, soaps, and the food prep area potentially. Avoid greasy, high-fat foods. They tend to sit in the stomach too long and come back on us sometimes. Consume liquids 30 minutes after a meal to avoid overfilling the stomach. Sometimes this is helpful if you get what's called early satiety or you feel full quickly. You don't want to fill your stomach up with a lot of liquids and then not be able to eat your meal. Eat a bland diet, usually room temperature or cold foods that have less odor, although many people do well with a soup. Sit up after meals. Oftentimes, if you lay down after a meal, you may experience more reflux and discomfort. Take your nausea medications as directed by the physician. You can try ginger ale or other products made with ginger, or like ginger tea, ginger wafers. There's a product called gingins, which is like a chew, which you can take if you're feeling nauseated. And there's also ginger extract supplements. 0.5 to 1 gram is generally the recommendation. One thing that people have tried, which is a non-invasive option for managing nausea, are called acupressure wristbands. And they're worn around the wrist, and they work to help suppress nausea. Acupressure bands can be found in any pharmacy in the travel area where people are buying products for seasickness. In addition to these measures, snacking on basic foods like crackers, cheese, pretzels, cereal bars, granola bars, yogurt, rice, dry cereals, dry toast, trail mix, small sandwiches are often recommended. If you're feeling very sick on certain days, start your day off with slices of a toast, tea. You can move along in the day to soups, maybe a potato, small sandwiches to avoid aggravating the nausea. If altered taste causes your nausea, think about sucking on candies, adding mint to foods, drinking juices as well. Work with your physician on medication interventions, as there are many classes of medications that will help with nausea management. To include a few, these include Compazine, Reglan, Zofran, Ativan, Decadron, which is a steroid. A lot of physicians will also use Emend to help with nausea management. If you are finding that the nausea medications that you are using are not effective, please contact your physician to review those medication and to seek more options. On a natural basis, certain spices can be considered stomach soothers. For instance, cinnamon, ginger, nutmeg, allspice, anise, cardamom, cilantro, cloves, cumin, fennel, and mint all have been shown to be effective for soothing the stomach. These things can be worked into smoothies, into your meals, into cereals or yogurt as desired. Moving on, another common side effect to chemotherapy treatments is either diarrhea or constipation. Diet changes for these side effects depend on a change in the amount of fiber intake. For diarrhea, it's generally recommended to eat low-fiber foods, lactose restricted, which means potentially avoiding milk and certain dairy products like ice creams. However, hard cheeses and yogurt may still be well tolerated. Probiotics may be helpful, as well as a soluble fiber supplement like benefiber or psyllium husk. On the other side, for constipation management, we tend to recommend a high-fiber diet with good intake of water, and discuss your need for stool softeners or laxatives with your physician. These stool softeners or laxatives could include Colace, Senecot or Dulcolax, which are stimulants, psyllium fiber, which is a bulking agent, and milk of magnesia as a laxative. Some people will even use Miralax as a laxative. Medication management for diarrhea, interestingly enough, can also include the use of psyllium husk as a binding agent, an antimotility like Imodium or Lamodal, or Sandostatin. As I mentioned, the diet differences between diarrhea and constipation involve changes in fiber. A low-fiber diet for diarrhea, foods that are included in this diet include white breads, refined breads, oatmeal, white rice, mashed potatoes. When it comes to fruit, applesauce, bananas, a peeled fruit cups or mandarin oranges are recommended. For vegetables, I would avoid salads and raw vegetables, but cooked green beans, asparagus, cooked carrots, cooked spinach, and squash may be well tolerated. You should avoid spicy foods, fried foods, popcorn, high-fat foods, and caffeine. Another spice that may be beneficial to this population is nutmeg, as it can sometimes slow our GI tract down. A high-fiber diet for management of constipation would include using multigrain breads, higher fiber cereals or breads, brown rice, multigrain snacks. When it comes to fruit, use fresh fruit with the skins. Prunes, dried fruit, and pineapple can be helpful. Eat more raw vegetables or eat more salads with your meals or as snacks. Senna tea, which is made from the senna leaf, can be helpful as a natural beverage. Green tea and hot beverages can also stimulate bowel movements. Let's move on to a loss of appetite, which can occur to many people during chemotherapy. And in addition to this, many people with a loss of appetite will experience weight loss. Weight loss is something we do want to avoid, as it can deplete our body's protein stores and energy stores and increase your likelihood of becoming fatigued. Eat small meals or snacks frequently during the day. This means, much like nausea management, you're going to eat maybe every couple of hours, with snacks and small meals. Keep prepared meal or snack available to grab. Place a snack bag when you're out. For instance, you can carry along granola bars, peanut butter and crackers as snacks when you're out and about. Try high-calorie beverages, juices, soups, and shakes made with protein powders. Added extra calories with gravy, milks, butter, avocado, olive oil, cheeses, and creams. Try new foods to accommodate the changes in taste, and take a walk right before a meal may actually help to boost your appetite. Eat with friends or family. Eating out is often a more desirable, pleasurable experience and will increase your appetite. Make a list of your favorite foods and have these available to fix quickly or for a friend or family members to fix for you. Definitely accept the help of your friends. Potential appetite stimulants that may help when loss of appetite becomes chronic are Megace, Marinol, and Remeron. You would have to discuss these options with your physician to determine if it's appropriate for you. Foods and herbs that may help with the appetite include caraway, cayenne, if it's not too spicy for your mouth, cinnamon, cumin, mustard seed, parsley, sea salt, and turmeric. The reason being is often these spices increase salivation, increase the taste or flavor to foods, and improve the enjoyment and our appetite with the meal. As I mentioned, add those extra calories and protein to foods to bridge the gap of small meals by using oils, cheese, beans, avocados. And you can use oral nutritional supplements like Ensure Plus, Boost Plus, Benecalorie, which can be added into soups or cereals or other foods, or Orgain for high-calorie snacks. We move on to sore mouth and difficulty swallowing. These often come from mouth sores or irritation to the esophagus. During this time, you want to practice good oral hygiene. Choose soft and moist textured foods that require very little chewing. Avoid salty foods, acidic foods like tomato sauces, orange juice, pineapple juice. Avoid dry foods, which may become too difficult to manage in the mouth, and those spicy foods like a cayenne or red pepper flakes that have been added to foods. Sugar may increase your risk of oral thrush or difficulties with your teeth, so you would want to be careful of high sugary foods at this time. Interestingly, cryotherapy or sucking on ice chips, 35 minutes before starting 5-FU infusions can help reduce the risk of mouth sores. This may be an option that someone can try, something which is not medicine or invasive. As always, work with your physician on medication management for a sore mouth or difficulty swallowing. Viscous lidocaine or lidocaine-based mouthwashes can be soothing and reduce the amount of pain in the mouth. To evaluate for infection contributing to that mucositis, you would need to see the physician. Pain medicines, starting with Tylenol with codeine or hydrocodone, may be necessary, and you would need to speak with your physician regarding those interventions. Soft textured foods are usually the best tolerated when you have mouth sores or difficulty swallowing from esophagitis. This would include applesauce and yogurt, soft fruits, fruit cups, scrambled eggs with some added cheese for extra calories, oatmeal or other cooked cereals, soups, and this time if you're losing weight, I would choose either a creamy soup or a bean-based soup so you have extra calories, milkshakes, creamy casseroles, tuna salad, egg salad, or chicken salad with a little extra mayo to make it nice and soft. As mentioned before, your oral nutritional supplements are helpful at this time, but you can make protein drinks at home by using whey protein powder, milk, fruit. Some people will add peanut butter or flaxseed oil. Bananas often can add in extra calories, blended together and sipped on during the day. You can also add whey protein to oatmeals or soft cooked fruit cereals, soups for added protein. Chemotherapy can also change taste in the mouth. By rinsing your mouth with baking soda and salt before and after meals, this may be helpful if you have strange taste in your mouth. Choose fruit marinades for meat or lemon, herbs, spices like garlic, onion, basil, mint, and pepper if tolerated to help improve the flavor of the foods. Try sugar-free lemon drops, gum, and mints to improve the taste in the mouth. Lemon or lime juice may help dull sweetness or combat extra saltiness in the food. These things can be added as just a few drops, taste test, and then maybe add a little bit more. Sea salt or a spritz of lemon juice may also help revive the flavor of foods if things start tasting like cardboard or have a very poor taste. If you find that you have thick saliva or change in the consistency of the saliva, alternate your bites of food with sips of fluid to help thin the food and make it easier to manipulate in the mouth. Sip liquids throughout the day. You will probably need about 8 to 10 cups of fluid in a day to stay hydrated. Hydration is important to thin the saliva and keep it from becoming too thick and pasty. Swish and spit with club soda or carbonated water may also help. Interestingly, chewing on carrots and celery, if you're able to, may also help to reduce the thickness of saliva. You can use a humidifier at home to moisten the air, and suck on hard candies or even frozen grapes or melon balls. Avoid alcohol or alcohol-containing mouthwashes. Alcohol can dry the mouth and make this problem worse. Although most people would think that chemotherapy patients are going to lose weight, for some patient populations, weight gain becomes an issue. Obesity increases the risk of other types of cancers. It may result from increased appetite from steroids or fluid retention. If you find you're retaining fluid, you should limit salt in the diet, increase your activity throughout the day. A lot of times people can gain weight because they have changed their activity level, don't feel like they're able to exercise anymore, so little bits of exercise will help. Please talk with the dietitian about appropriate strategies to lose weight and the appropriate timing for those strategies. Many chemotherapy drugs can increase the risk of dehydration. In addition to the side effects, like vomiting and diarrhea, increase your risk of dehydration because of those fluid losses. It is very important to stay hydrated, keep water or electrolyte drinks with you constantly, and drink at regular intervals. An easy strategy might be to take 1 or 2 ounces every 15 minutes. Coconut water, vitamin water, Propel, broth, Pedialyte, G2, which is a low-calorie Gatorade, are good options for electrolyte drinks. As we've mentioned before, chemotherapy can reduce blood counts and cause what is called neutropenia. This increases your risk for foodborne illness. It is very important to have safe food handling at this time. In addition to the neutropenia, chemotherapy can reduce blood counts, platelet counts, neutrophils, and increase your risk of the foodborne illness. Avoid foods that are raw, live sushi, raw oysters, raw sprouts, unpasteurized milk, and raw eggs at this time. You should cook your meals with meat to well done. Neutropenic diet versus a low bacteria diet is controversial and may not benefit patients. You should focus on good food handling and safe cooking. Wash fruits and vegetables well at home. However, I would avoid salad bars, as it is uncertain how the food has been handled and how long it has been sitting on the salad bar. Pre-cut produce in the grocery store can be problematic. If you're able to, it is a better strategy to buy a whole cantaloupe or whole watermelon and cut it up as needed. Deli meats can be problematic. They do have an increased risk for bacterial infection. Antimicrobial herbs that may be helpful in your cooking is cilantro, garlic, honey, limes, onions, oregano, and star anise. The mushroom extract supplements, one of which is called AHCC, may be helpful in boosting the immune system, but you will need to check with a dietitian or physician as to whether or not they would impact your chemotherapy. Safe food handling, an easy thing to remember: clean your hands and surfaces often. Separate different types of foods. Separate your obviously raw and cooked foods. Use different cutting boards to prepare meats, fruits, and vegetables. Cook to your proper temperatures and chill promptly. Put everything into the refrigerator right away. Wash your dish towels often. Wash sponges in a dishwasher or boil for 5 minutes to reduce the bacterial load. Rinse fruits and vegetables well before peeling. Cut away any bad spots. Throw away outside layers of your lettuce or cabbage. Thaw foods, please, in a microwave or refrigerator, not out on the countertop. I provided a list of proper temperatures to cook the meat at. Generally speaking, ground meat needs to be cooked at a higher temperature, 160 to 165 degrees. A fresh beef or lamb or pork can be cooked up to 145 degrees and let it stand for a few minutes after it's cooking. Poultry should be cooked up to 165 degrees. Eggs in a dish should be cooked to 160 degrees. Any leftovers should be reheated up to 165 degrees. Certain chemotherapy medications can cause what is called cold sensitivity. This means that your extremities, especially hands, will be sensitive to cold and potentially even painful. Ask for help from family members or use gloves if you need to reach into the refrigerator or freezer. Avoid drinking cold beverages or eating cold foods at this time. Drinking beverages using a straw may be helpful, and avoid cold temperatures and touching those cold products. It is still important to drink fluids well, so drink warm or room temperature water or other fluids to stay hydrated. And definitely avoid drinking alcoholic beverages. I usually suggest people keep shelf-stable foods and beverages for easy use, so they can avoid using the refrigerator as much as possible. These could include juice boxes that are designed for kids' lunches, individualized milk cartons, fruit cups, your fresh fruit, which can be kept out on the countertop, and of course, crackers and peanut butter, granola bars, and other easy snacks to grab. Many people are tempted or swayed to take additional nutritional supplements during this time. Be very careful of information on high-dose supplements, herbal remedies, or other vitamin supplements that are promoted to cure cancer. It is often difficult to sort through true evidence-based information and information or propaganda aimed to sell you a product. Some supplements, especially herbal supplements, may interfere with your chemotherapy treatment. For example, St. John's wort interferes with Gleevec, green tea interferes with Velcade. St. John's wort can actually interfere with quite a few chemotherapy medications. Speak with your physician or dietitian to determine if you have a supplement you wish to take, whether it will interfere with your chemotherapy. Seek out information from your physician or dietitian regarding any questions that you have about diet and supplements. For patients at the Lynn Cancer Institute, you may contact myself, Marie Morandi, at 561-955-5637, or you may contact Catherine Albuquerque at 561-955-2184. Thank you very much for your time, and we wish you well.